All right, good morning, everyone, and welcome. My name is John Donadio. I'm the Executive Director of the New Jersey Association of Counties, and we want to welcome you to this week's virtual workshop called Mental Health Resources During a Pandemic, where you are going to hear from county subject matter experts from across the state that I'm going to introduce shortly. But before we do that and take care of some housekeeping matters, I'd like to just have a moment of silence for our friends in Middlesex County who have just really had a rough 2 weeks. Middlesex County Commissioner Ken Armwood, 46 years old, passed away suddenly earlier this week. He was just an inspirational leader in Middlesex County, loved in his hometown in Piscataway, and just a wonderful, wonderful person who left us too soon. So if we can just have a moment for him, I appreciate it. Thank you. Yeah, thank you. And again, our thoughts and prayers go to him, his friends and colleagues and family members. So some housekeeping matters. If you have any questions throughout the panel discussion, please make sure to use the Q&A button on the bottom of your screen and not the chat button. If you use the chat button, Angela Wolf is going to yell at you. And she does a great job of managing. She's not going to yell at you. She's too nice to do that, but she's going to tell you to please put them in the Q&A because the chat button is for all of the panelists for us to communicate with each other. So any questions, make sure to go in the Q&A. We will try to answer them as we're moving through the conversation. If you would like to receive your continuing education credits, and this one has been approved for a variety of them, please make sure to see Kim Nolan in our office, and we will make sure to forward the certificate to you. So with that, I am very pleased to introduce just an outstanding panel of county mental health administrators and human service directors, many of which I've known for as long as I've been in this spot, and who are just wonderful people and resources and friends to have and do just a tremendous job in advocating for those who are in need across the state of New Jersey. So I'm glad to have you there. We're going to focus on the services that county governments provide. And that's, again, the focus of this workshop. So with that, I'm going to go from how I see them on my screen, and I'm going to go with the newly appointed mental health administrator in Somerset County. Congratulations, Meg Isbitsky. I hope I pronounced your name right.
You got it.
All right, excellent. So welcome and congratulations again.
Thank you.
And then my pal, Mary Grace Billick, in the Mercer County Director of Human Services. Mary Grace, thank you always for being there.
Good morning, John. You're welcome. I'm happy to be here.
And for all the counseling sessions that you and Lisa Cerny provide to me over the years. And my other good pal from Gloucester County, Lisa Cerny, the Director of Human Services in Gloucester County, and President. Right, still President, Lisa, of the
till the end of the year.
Yeah. So they're lucky to have you and your leadership. Next up is Melissa Niles, who is the County Mental Health Administrator in Cumberland County.
Hi, everybody.
How are you? It's good to see you, Melissa.
Thank you for having me.
And then next we have and relatively new Hudson County Mental Health Administrator, Robin James, who is also president of the County Mental Health Administrators Association. So Robin, thank you for being here.
Morning.
All of you, of your time. And you are going to make my life very easy over the next hour. I'm going to turn the show over to you. And I think we're going to get started first with Mary Grace and Lisa. So good luck and thank you again.
Good morning, everyone. We can start the PowerPoint.
Angela's going to do that. Okay.
Is up.
I guess we just can't see it.
Oof.
Oh, there you go. Just go to your gallery, Lisa.
Now you're going to see my technology at its best. Okay, I got it. So good morning, everyone. Again, I'm Lisa Cerny. I'm the Division Director for Gloucester County Human and Disability Services. In Gloucester County, we fall underneath the Department of Health and Human Services. And that encompasses 5 different divisions within that department. So there's the Division of Social Services, Division of Human and Disability Services, Senior Services, and Health Department, as well as Medical Examiner's Office. Part of Human Services also includes mental health services, which is why we're here today. We provide a variety of services. We look at the full continuum of need for each individual, from soup to nuts. And, we are able to sit at the table at a variety of, in a variety of forums. One of them is the Office of Emergency Management, where we sit on the local advisory board, and we have a seat at the table at the command center when a crisis occurs, whether it is natural or weather related, or in this case, a public health crisis. And our role really there is to be the navigator for the resident of our county, so that they're able to receive recovery information, mass care information in an avenue that they are able to understand. So we try to get rid of all of the acronyms, put it in layman's terms, and make sure that we have a whole community planning approach. And you're sitting at the command center, it's a variety of phone calls that we're able to take in, such as nonprofits calling, looking for our personal, the PPEs, as well as someone who is running a group home and who may have someone who is now tested positive for COVID. What do we do with this individual? How is this individual placed? Services along those lines. So we assist with the linkages, as well as the logistics, and help also translate for emergency management what they need. So if someone is calling in and they're using the specific terminology, we're able then to just say, you just need this information, and we're gonna send it out in that manner. So we've obviously looked at a lot of relied heavily on our technology and on our websites, or our first line of defense. And we've also then tapped into, each county has a mental health administrator, and worked side by side with our mental health administrators in order to ensure that folks are know where to get the services that they need. So we are the bridge between the community and how government operates, and mental health services and resources are there accessible to everyone at this point. So I'm going to turn it over to Mary Grace. You can flip. I think I ran through the PowerPoint a little bit. But
Yep, you can just stay there. Thank you. Thanks, Lisa. I appreciate the putting it, the whole idea is to put this in context, right? Oh, Lisa lost her power. That's good. Yeah, so I mean, I think it's
excuse me, we're environmentally conscious here, so the lights, if I don't move, they shut off automatically.
You need to move more, I think. So I think it's important to put it into context. I'm Mary Grace Billick, Human Service Director for Mercer County. And just like Lisa, we have a bevy of divisions that sit underneath. But during the crisis, I think one of the most important things, and the truth is, this is not your grandmother's crisis, right? This isn't anything we've ever experienced before. It isn't anything like what happened in September 11th. It isn't Hurricane Sandy. It's something that has kind of laid on top of us and has not gone away, right? Nobody thought on March 9th, when they closed the state, and I was in Miami, so trying just to get back to New Jersey was a whole other complication. But I'm glad I'm not in Miami this week. So it isn't the same, right? The trajectory is very long, and people who normally experience mental health crises and have mental health needs, that's everybody today, right? People trapped in their homes, children who aren't interacting with their friends, and who are homeschooling with parents who are stressed out. people who aren't generally part of our, part of our trajectory, right? So it's really created a whole new, what I call a mental health taxonomy, right? That we're not operating in the same way that we've operated in the past 30, 40, 50 years, addressing the mental health needs of our community. This is a global mental health need. They're talking about this is going to be the next pandemic is the mental health needs of our community. And I think that there's a huge amount of truth to that. Next slide, please. Lisa was right. We were going to talk a little bit about Lisa, but that the fact that it's not just the public, right? You've got workers like first responders, children who are in virtual settings, essential workers. You forget that there are people in the grocery store who weren't allowed to stop going to work, right? Child care centers closed, but they did not close the grocery stores. People still needed to get toilet paper. We remember what that was like in the beginning, right? Toilet paper and paper towels, and you couldn't access any, we couldn't get any Lysol products, right? Now, finally, right? I think it's 15 months later, now we can find some Lysol products on the shelves. But I think what's really important is that our solutions and the things that we have to do next are not going to be the same things that we've had to deal with before, right? What our mental health administrators, they manage a system of care that's really identified for very specific populations, seriously and persistently mentally ill, those with addiction needs, right? You read the newspaper, the use of alcohol and binge drinking among women and among the general population is increased exponentially. That's going to come back to bear. So I think that's the context that we wanted everyone to think this through, that our mental health resources, the way that they're going to look as we move forward is not going to be the same. And so I'm welcoming our mental health administrators to start. I think, however you three want to do it. I don't know if Melissa was going to go next, or was it going to be Robin? You guys can take it away.
Right. So hi, everybody. I'm Melissa Niles. I'm from Cumberland County. I'm very proud to say I'm from Cumberland County. And as you know, every county, all 21 have autonomy. So each is set up differently. And in my county, as we all do, we wear a lot of hats. So I'm also the Human Services Director, and I enjoy very much, I learned a lot from Lisa Cerny and Mary Grace. And I'm also the mental health administrator, and I'm the drug and alcohol coordinator. So the purpose of the mental health administrators, every county has one. And as Mary Grace begun to say, we oversee funding and community programming for community and inpatient services for mental health, and also for substance use treatment and recovery. So again, that's a different title, that's alcohol and drug coordination, but many of us are both. So I'm just going to talk about them as if because it all goes together. The mental health administrators, we are in charge with facilitating advisory boards and committees that exist for the purpose of analyzing community need and analyzing any gaps, barriers, or opportunities. For example, in Cumberland County, our boards have merged in 2012, the Mental Health Board and the LACADA, which is a local advisory council for drug and alcohol, merged to become the Mental Health and Addictions Board. Other counties, they still have their boards separate, but still the boards have a common purpose, which is to bring the providers together, provide opportunities for the community members to have a voice, provide an opportunity for those who are either directly diagnosed with or family members of those with substance use disorder and mental health disorder. And we also, I'm not sure if every county is doing it, but most counties, we have what's called a stigma-free campaign, which is heavily focused on putting out the public service message about the stigma attached to mental health and substance use needs to be eradicated because people in recovery are everywhere. And just because somebody might be struggling with something, people are not their diagnosis. They happen to be people who have things going on in their lives. And part of what keeps the problem going is stigma. So, I know my county, we've declared by resolution to be a stigma-free county. And that program is gained a lot of momentum. We also create new programming and services by issuing requests for proposals for various programs to ensure that the services are relevant, innovative, and they help individuals to improve all areas of wellness, including physical, emotional, social, occupational, etc. Also, we advocate for individuals and families, provider partners, and the systems to better serve the continuum to ensure individuals and families are connected to resources and treatment as needed. So one of the things that we are charged with is to field phone calls or any type of interaction from the public or the local community who have concerns or a need. We act as the mediator, to try and problem solve. We come alongside the person, and we try to, as quick as possible, get their needs met and solve the problem. We also have public education opportunities. Prior to COVID, we had at least 4 times a year, at least, we would have various educational programs in the community to educate the community. Since the pandemic, things have shifted to virtual, but one of the, now we're more than 12 months out from the onset of the pandemic. So one of the benefits has been the advent of technology and the availability to be virtual. One thing I found, though, which is interesting to me, is that even though I'm not traveling to Trenton, because I used to spend a lot of time traveling to Trenton a few times a week, right, everybody? Now that I'm not traveling, I'm busier than ever. So I have no idea how I got my work done before when I had to travel. It's just, I guess, work fills, the work expands to fill the time, I suppose. But yeah, so we're all very busy. And but yes, we love serving our community. We all, all 21 counties, we really do have a great team. One of the things that we're all pushing for and concerned about is we want the community to know that we are here, and we want the community to know how to access us. Because one of the common things that we hear is, well, there's all these services, but people don't know about them. So in my county, we're being innovative, such as, there's, I don't want to call it a TV show, but it kind of is like a TV show that's going to be posted on social media that highlights different departments and counties. We're on social media. We're out in the community. We come to the community, we go out into the streets, into the community, rather than, which is a paradigm shift, rather than expecting people to find us and come to us, we are going to them, and it's working out very well. So that's another big thing is, we're really, essentially, we are here to serve the people. And we also oversee, each county has DRCC, which is Disaster Response Crisis Counselor. And DRCCs are, it's through the Division of Mental Health and Addiction Services and the Disaster and Terrorism Branch. So they're responsible for administering as well as providing these emergency response behavioral health programs that assist citizens in New Jersey. So New Jersey is one of the first states to actually certify its behavioral health responders in preparation for response to disasters and traumatic events. So it's really a development, and I'm reading off of the pamphlet that the state of New Jersey has put out that describes the disaster response crisis counselor, and it's really a cadre of paraprofessionals and professionals. So and they come from different backgrounds. It could be mental health, could be Office of Emergency Management. It could be a social worker, it could be a teacher. Any person who is interested, because it's a volunteer program, in becoming a disaster response crisis counselor will receive, they get vetted, you have to apply, and there's certain curriculum that's required we don't just unleash people into the public. It's very coordinated, it's very regimented, and it's non-clinical. So a person does not have to have a master's degree or anything like that. What's required is a desire to help and the ability to be committed and follow through and be available when you can. So one of the ways we've been utilizing the DRCCs during this pandemic is having DRCCs present at the vaccination sites, just to provide comfort during that 15 minutes of monitoring post-vaccination, just to provide water, provide comfort. It's not a therapy session. And another thing that we've learned and that we really focus on is one of the ways to help people is to not be so direct. Like, we don't have to say, would you like mental health counseling? Because human nature is like, I don't need it, but maybe that guy down the street, or I know somebody. So one of the ways we're just like, how can we help? Are you thirsty? Do you need to make a phone call? What do you need? So that's what a disaster response crisis counselor does. Because otherwise, if we come on too strong, it scares people away, again, because of stigma. But we're working on that. And another thing we do, last but not least, we have consultation and technical assistance with various other partners to advocate for the considerations related to mental health and substance use disorder, including with public health, the Office of Emergency Management, law enforcement, sheriff's office, prosecutor's office, jails, schools, nonprofits, municipal leadership, faith-based networks, and the larger community. So in Cumberland County, we are all about partnerships, and we might rank at the bottom for a lot of things, but in my opinion, we are the best at networking and partnering and making things happen. We have a lot of innovative programs, and we want the community to know that we are here for them. So thank you for letting me share a little bit about what mental health administrators do statewide in each county. Thank you.
So thank you, Melissa. Before we move on, I have a question. I know it was answered in the Q&A in typed, but I think, maybe just a brief overview from both the human service directors and the mental health administrators on how you work with your county adjuster offices. So if Melissa or Meg or Mary Grace, since I see you guys first on my screen, if you can follow up, that would be great.
Okay, so I'll just say really quick, again, every county is set up differently. In Cumberland County, our county adjuster, I believe, is in the office, in the Board of Elections office, I believe. So when I get phone calls for persons who need, for example, a county adjuster would come into play if somebody is committed against their will or something like that in a mental health setting. So the county adjuster is the one who advocates and defends and comes alongside of that person. So I defer, I'm not involved with those directly. I defer to our county adjuster.
And also just worth mentioning that it happens vice versa as well. Our adjuster's office will send over either residents or family members to us so we can help them with any other community supports we can offer. So it's a good working relationship.
Great, thank you. Lisa, you have any thoughts? You jumped, I see your picture again.
No, I'm good.
Or did your power go off again?
Lights are on, no one's home.
All right, I'll reserve some additional questions until we hear from Meg and Robin.
Robin, if you want to get, yeah, good.
Yes, absolutely. Good morning, everyone. Robin James from Hudson County. And much like the other panelists, I wear two hats. I'm the mental health administrator, and I'm also the alcohol and drug coordinator. So my portion today, I'm going to be talking about some trends that we've seen in relation to the pandemic in regards to mental health. So before I get into it, I'd like to just frame and talk about what we consider mental health to be. So mental health is our thoughts, our feelings, our behaviors, and how it affects our everyday functioning, how we view the world, and how we operate within the world. Having said that, all of us have a baseline level of functioning. Baseline meaning our norm from day to day. Some function incredibly well, do amazingly, some function very poorly, and some people are in the middle. Sometimes doing well, sometimes doing okay, sometimes holding on. So when we talk about mental health, we have to look at it as a continuum with ebbs and with flows. I always give an example where I compare mental health to physical health. And the example I like to use is a person who's a diabetic. You might have somebody managing diabetes where times they're doing incredibly well. They're following medication regimens, they're going to medical appointments, their nutrition is on point, and their diabetes is doing well and managed. You might also have the other end of the spectrum where sometimes they're not doing any of those things. They're not following guidelines that are conducive to somebody managing diabetes, and they're doing very poorly. So when we talk about mental health is exactly the same. Ebbs and flows. We're not always doing amazing, and we're not always doing terrible. So having said that, we're going to talk now about some trends that we see in relation to the pandemic. I'm speaking in generalities. I'm talking about statewide trends. I'm not going to focus specifically on any county. So some trends that we're seeing in relation to school and relation to the online learning. Certainly all of us know there's logistical nightmares with accessing online services, remote learning. Students are having difficulty. Some students are falling behind academically and emotionally, and there's not equity in technological services. Not everyone has the same devices. Not everyone has access to Wi-Fi. So we're starting out where not everybody is on an equal playing field. Coupled with that, some students are reporting feeling fearful of being on camera. Sometimes they're struggling with body image. Sometimes they're struggling with their appearance on camera. Sometimes there's difficulties in relation to grooming. Either students are not able to get out, parents are not able to afford the grooming, or they're fearful of their youth going out and engaging in those activities. So lots of difficulty with youth and how they feel about appearing on camera and engaging in school virtually. We also have to talk about isolation, fear, and anxiety, which has increased tremendously in all demographics and all age groups. So when we take trainings on disaster and terrorism, one of the trainers does an amazing job, and he talks about disasters in regards to bookends. There's a beginning, there's a middle, and there's an end. In this pandemic, certainly not the case. We don't have an end point, and we don't know what the end result is going to be. While we have progress and we have signs of hope, we don't really know next steps or what to anticipate. So those people that like closure, I'm certainly one of them. Those people that have anxiety, we have no idea what's in sight and no idea when it's going to end. So there's ongoing pressure of the unknown. With that, right, people are feeling isolated, people are feeling lonely. We have the older population that are being affected disproportionately by isolation. Maybe they live alone, maybe they don't have as many opportunities to get out of the house, or maybe they're fearful of getting out or going back to technology, don't have those opportunities for connection. Then what we have to consider is the vulnerable population. We have people that are homeless, people that are experiencing mental health difficulties, people that are experiencing substance use. Those people are going to have more barriers to service, and they're going to have a more difficult time in accessing services. On top of that, I'm not telling you guys anything that you're not seeing and hearing. We have to talk about unemployment, separation from jobs, loss of income, loss of livelihood, certainly in some cases, loss of health insurance. That's going to put a huge stressor on families who might have already been having difficulties with making rent, making mortgage payments, or making ends meet. We all know New Jersey has a very high cost of living, so now you have these extra stressors on top of that. With that, almost every county, I'm guessing, has heard the term food insecurity, right? Families who might have been struggling or barely making ends meet now there's this trend of food insecurity where families don't have enough to provide for the members in the household. So that's what we're also seeing. We definitely can't talk about mental health without talking about substance use. So we're starting to see and hear rises in overdoses, rises in substance use, and residents in general sometimes being fearful of accessing services or going to hospitals due to fear of being exposed to COVID. So increased stressors, increased extenuating circumstances, rise of mental health difficulties, rise of substance use. Now we have to look at a rise in suicidal ideation, which is thought of suicide, and suicide attempt, right? Those things go hand in hand. Again, because what we said, we don't have an end date for the pandemic and we don't necessarily know when things will improve. Having said all that, we're talking about a lot of escalating factors, a lot of escalating tensions. We're also hearing increases in domestic violence. People are sort of stuck in the house together for longer periods of time. Previously, people might have been able to leave the house more frequently for errands, grocery shopping, work. Now it's sort of a powder keg situation where these escalating tensions are happening and people are sort of trapped together for longer periods of time. Then you have to look at it as youth. Youth are also in that situation. So there's rises in cases of child abuse. Youth are home for longer periods of time, lesser experience and opportunities to get out into the community for school. And previously, when they would go to school, there would be teachers or guidance counselors that can see them in person, talk to them in person, and be able to report incidents on their behalf. So having said that, our regular job is to help people find services. We all know when people are calling, even prior to the pandemic, most residents needing services do not call with one singular issue. Residents will call with a multitude of issues, and it is our job as administrators to listen to them, tease out, offer guidance, and focus on what it is they want to work on. Sometimes there's a disconnect. Sometimes what I think is important is not what the person deems important. So we really have to listen to them and try to help and figure out the resources. Having said that, before I switch to Meg, who's going to dive into resources, I will say all of this can be framed by thinking of it in this kind of way. During the day, professionally, we're all administrators, we're all directors, we're all leaders. We're wearing that hat. We're doing our best to navigate this situation, trying to be helpful, trying to be directive, trying to lead the team. When I take off my administrator hat and you guys take off your director hats, we are normal, everyday, average people in a pandemic. Sometimes, as much as our job is to be professional and be that resource, we're also allowed to be regular people in a pandemic. So we struggle with that. We can imagine how the public is also having difficulty navigating jobs, parenting, caregiving situations, and being normal people in a pandemic. Having said that, I will ask Meg to take it away for resources.
So Meg, before if you don't mind, you get started, and I very much want to hear what resources are available, because to hear, Robin, you frame the escalating factors the way that you did are just alarming, to say the least. And in addition to the resources that we're going to hear, that we're going to make available to residents across the state, what can state leaders do? Like, what can we do to mitigate some of these stressors? Because a lot of this is driven by, there doesn't appear to be an end in sight, right? I mean, we had to get through first, 15 days, and then we have to get vaccinated. Now we're hearing that there's variants, and now schools were open, and now, well, they can still go virtually next year. There's so many, the narrative of this pandemic changes regularly. What can we do to encourage our state leaders to be more positive with their messaging, more consistent with their messaging? And I know that's a loaded question, but to hear what you're going through, it's alarming. It really is. Any thoughts from anyone on the panel on this?
I would just say, John, one thing that we talk about frequently in our office, We always appreciate when there's opportunity and funds and resources. I think as much as time permits, I think we have to be very thoughtful in our planning. And I think we really have to take the temperature of our respective counties and see what the needs are. Melissa said earlier in her presentation, every county is completely individualistic. So I know sometimes there's not always the luxury to have a long time to plan, but I think we always have to keep our finger on the pulse and know what the needs are and take the temperature and continue to reassess for when those funding opportunities or those resources come down the pike. We know best how to, how to help our residents. And one thing that I think all mental health administrators always would agree and push for, mental health and resiliency should always be there in the background, not just when things hit the fan or not just in times of unusual circumstances. We always should be focused and concerned about mental health, about well-being, same degree as physical health, not just when things are going unwell and then there's that panic and that there's that instinct, oh no, what about everybody's mental health? So that's a good reminder during this time that mental health should always be in the background or in the forefront and on people's minds, not just during disasters.
The other thing thank you, Robin, you did such a nice, eloquent job talking about, kind of again, framing where we are, what we don't know, right? But the other thing is, John, there have been some amendments and some changes to the way in which Medicaid facilitate services, right? The allowance for telehealth. I think there's some anxiety, right? Our mental health providers have seen 90 to 94%, 95% show rates. The normal show rate for a mental health provider is about 65% in a good week. When you can get 95% of your clients to show up because there's no barrier, half of any work that goes in, probably more, maybe it's 70% of the work that happens, is getting someone to show up for a service, right? And when they don't show up, you can't help them. So some of the things that have been adjusted because of the pandemic, we want them to continue to consider. I'm not saying that the best way to do an intervention with someone is always a virtual intervention, but the fact is we've gotten adolescents to come to treatment in a way we've never been able to get them before. They use their devices for everything, right? So I think we need our leadership to help us navigate and support that some of the things that have changed, we went from 1800s into the 2021s. We'd like them to stay, right? Some of these things need to stay in place so we can continue to do our jobs. That's flexible and it supports our community, because not everyone has time to I have 3 kids, I have to find a babysitter. I have to get on a bus to get to my service. Now I don't. All I need is access to a computer and some private space.
So I have a follow-up question, if you don't mind, to that, and maybe 2, and then I promise, Meg, we're gonna get to you. So do you find that the virtual sessions are as effective as in-person sessions? Or does it depend on the age of the person?
No, I actually, let me tell you something. There's not good data for either side. I would imagine that there's an opportunity, and I'm not the mental health administrator, right? I was a therapist for 17 years, so I feel like I can definitely speak from a place of understanding, but that was 20 years ago. So it's been a long time. I just counsel John on a regular basis. That's my current job. And Lisa when she's on the edge. But, I think that we have to do some data collection. I think that the fact that you're engaged with a professional and someone who can support you, that's what matters. If you don't come, you're not getting it.
And this is Melissa Niles. So one of the things that our county does do, and it's only one other county provides direct care besides us. So we do have a clinic. It's a co-occurring, it's ambulatory for substance use and co-occurring mental health disorders. So we have anecdotal data from the clients and also from the counselors. and the general feedback is, you know, I thought that this was going to be awkward. I thought it was going to be difficult, but I really kind of enjoy it. And the people, I mean, I'd be interested to say what's the impact, if any, because you still kind of get, even though you're not in person with someone, you still get that connection, which is really what we're trying to do, is to get people to connect and not be so isolated. So I don't know if the level of connection being in person versus virtual, if that's equal, but it's been a very positive response. And even for our older adults, sometimes, you know, we get the top of the head, but that's okay. We just keep going. We just keep going no matter what. And we just have to make sure that we make, you know, at the beginning of every session, we have to, there's standardized questions. Are you in a place that's confidential? Do you feel comfortable where you are? Because it's up to the counselor to be the gatekeeper and make sure that that person is in a place where they can talk openly, because we would do them harm if we were to require them to log, like, for example, Robin talked about the domestic violence. Some people are not comfortable, and it's not safe for them to be virtual when there's other persons around. So it is something that I hope can stay, but it's been overall positive response. So.
And John, I would just say that we would want it to be a hybrid. Do you know what I mean? Like, it's not one or the other. I think it still needs to be a combination of the two. You know, maybe someone needs to be seen in person once a month, but they have a weekly call in and have a conversation with the counselor through the telehealth and things along those lines. But I do think that it should stay as a hybrid model. And to just piggyback on what Robin was saying of each county's individuality, and that the state takes into account when they're developing proposals, that it should be on an individual county basis. Cookie cutter approaches, especially when it's involving a human being, may not necessarily be the best process. So what works in a Bergen County or a Hudson County may not necessarily work in a Somerset or a Cumberland or a Salem or a Gloucester County. So we just need to be aware of the true dynamics of the Garden State and how really diverse we are even by county. And the last is that I will say is that everyone wants to be helpful, and that's a great, every county, every state department, every county department. But I think you need to leave the expertise to the subject matter experts. So, and if you're not going to do that, then you need to work cooperatively and in a partnership with that subject matter and take that advice more as a guidance, and rather than saying this is what we're going to do in that realm, if that's not where your expertise is.
Yeah, and thank you, Lisa. I want to follow up with one other thing. There's actually two interventions that are being used at the FQHCs, the Federally Qualified Health Centers. One is the Cobalt method, and the other is called the Cherokee method. They are specific interventions for individuals who have have had a cardiac incident. And so those are more people who they don't engage on a regular basis in your mental health service provision. And the outcomes of those, they're telehealth interventions with a mental health provider, because once you have a cardiac incident, the likelihood that you're going to suffer some kind of situational depression because your entire life has changed, right? You're not allowed to do certain things. You're eating differently, right? So they offer, I think it's 6 to 8 telehealth visits with a mental health professional, and they have amazing outcomes. So there is research, there are projects that actually are very specific. And I think those underpin and help support the fact that those human interactions and those interventions with professionals do make a significant difference.
I mean, thank you. Those were terrific answers, and I'm glad to hear that you're looking for more of a hybrid type of model moving forward, because one of the concerns, particularly with students, is the socialization. Sorry about that piece of it. because you have, like you said, and I have a 16-year-old, he's on his phone, he's on his Xbox, he's virtual learning, 3 days a week. How do you encourage them to, interact with adults and other people moving forward 10, 15 years down the road? So there's a real concern, I think, about the long lasting effect of, these virtual workshops and virtual learning and things. They've been terrific. We're able to do this and have a great conversation that we wouldn't have been able to have 10, 15, 5 years ago, perhaps, but, there's something also to be said about, being with someone in person. So I guess I like the hybrid model that you took. So Meg, I promise I'm going to not ask any more questions and let you have the floor now.
Okay, sounds good. Thank you, John. I'm going to just share my screen because it's a kind of an info dump. So I want to make sure I can at least have some visuals and you guys can have a better understanding of what I'm talking about. Is everybody able to see? Okay. Sounds good. So I'm just very briefly going to talk about some mental health resources for New Jersey residents. Everybody keep in mind, this is a very short snapshot of everything that New Jersey offers. So it's more going to focus on just some high level introduction, more so on pathways to getting into services rather than listing every single one. So before we go into that, I really just want to focus on what that actually means in New Jersey. So about 1 out of 5 adults live with a diagnosable mental health and or substance use disorder. We use the term co-occurring just to define that there's a presence of both mental health symptomology and addiction. But that doesn't mean that 1 in 5 people have a diagnosis or are in treatment. We just think that if you looked at 5 adults, 1 of them is walking around with some kind of symptomology. So that's about 1.3 million people in New Jersey alone. We also know that about only 50% of those who would actually benefit from mental health services will access them in any point in their lives. And that's even less so seeking out some kind of addiction treatment. So we know that there's a portion of people who are walking around without a diagnosis, without probably knowledge, and without receiving services. And we also know there's about a 10-year delay in seeking treatment from when any kind of symptomology first onsets. If someone's going to seek treatment, it's going to take them a little while to get there. So if we kind of look at why, we have a few barriers. One is stigma, and that was touched upon by a few of our panelists. I mean, I think we can argue that we've come a long way at the fact that we're even able to have this presentation and that NJAC is using this platform for such an important topic means that we've come a long way, but I think we all know that there's much more to go, and it really depends on even different groups of people have even more stigmas, including different genders, cultures, sexual orientations. We know that there's still a huge negative association with mental health and addiction, and it'll really prevent people from reaching out because of the marks of shame and the negative stereotypes of what that says about that person. So just having conversations like this does a huge amount in reducing that stigma. We also know there's kind of a lack of knowledge, both about just mental health and addiction. A lot of what Robin said about understanding mental health as a spectrum, more so versus sick and not sick, and also just about the available resources, which I'm going to get into in just a moment. And lastly, cost of care. We know notoriously mental health care is underfunded and can be quite expensive if you're paying out of pocket. This was so before COVID. A lot of private practices don't take insurance. And now that so many people have lost their jobs and their ability to actually have insurance, we know that this has become more needed and also more of a barrier. So where do we begin? Because as I think we've all remarked, this is a really difficult continuum of care. And if somebody's in crisis, trying to reach out and access services is almost impossible. And, it really differs. We're talking about how we basically have 21 different New Jerseys. So the process, the resources, they're all going to be different by county. So that's why I'm kind of just going to emphasize more pathways than specific agencies, because it'll be a little bit easier to know where to jump in. So very briefly, This is a very overwhelming slide, which really just makes my point about how much there is. Statewide, these are just a few snapshots of some different resources that people can access in the state. And basically everything that I put in this presentation, I'm going to drop in the chat after, because this can be even a little overwhelming right now. But just some resources I do want to highlight are our crisis lines. So our suicide prevention hope line, our Reach NJ addiction hotline, which is if you were trying to find some kind of addiction treatment in New Jersey, our second floor youth helpline, which is exactly what it sounds like. Perform Care is our children's system of care. It's basically how you would access services in New Jersey on behalf of a youth who's 21 or under. So you dial that number, they kind of screen you and connect you to who in your community can help. The NJ Mental Health Cares support line for emotional support, the DRCCs that Melissa already touched upon, and just a new program that's called New Jersey Hope and Healing. They are a FEMA granted program that came through New Jersey Department of Human Services, and there's 12 providers throughout New Jersey who have this grant to provide emotional support, support groups, information and referral, and psychoeducation. So I'll make sure I put that in the chat so everyone can kind of see what agencies cover which counties and who they can access for any supportive services in their local community. So community agencies, sometimes they're what we can call our nonprofit network. There are agencies that really focus on providing, whether it's individual, group, or family counseling, psychiatric medication, or inpatient treatment. They are really our partners when we are serving some of our lower income residents and our medically indigent residents, which means people who are either uninsured completely or underinsured. So many of these agencies, they do receive funding and they do have sliding scale fees. So they can really focus on trying to bridge that gap for our residents who can't afford a $200 session weekly, which I don't know many people who can. We also have our designated screening centers. So every county in New Jersey is mandated by our screening law to have at least one entity that serves as a psychiatric screening center. So that's really what I like to think of as our mental health emergency departments. Every county has at least one. Some of the bigger counties have 2 or 3. They can either be located in a hospital itself, in the emergency department, or in a freestanding nonprofit in the community. And really what their role is to evaluate people who are in crisis psychiatrically and are displaying some type of symptoms that would make them a danger to themselves or others. And they basically screen them, stabilize them, and they try to intervene before something happens, a la like suicide or homicide, something more severe. They try to intervene in the community and get our residents to the right level of care that they need. So whether that's some services where they're remaining at home or they're in an inpatient facility, whatever they need, it's very specific to the individual, kind of tapping into what Lisa said before about having that flexibility and being able to offer different resources for our different residents and for what they need in that moment. There's not just one way that we have resources. And to me, I think that's the beautiful part about New Jersey is we are so resource rich. And so anybody who is at whatever level of crisis or need or wellness can tap into what they need to. And private practices, I touched on that a little bit before, but those are more so our independent mental health professionals and sometimes our prescribers. So they're not attached to a larger agency or hospital. The term literally means they're privately practicing. And so they're very apparent throughout all of our communities in New Jersey. There are thousands of them, if not tens of thousands. But the way that I recommend accessing these services is kind of to do it a little bit backwards. In my opinion, it's a little difficult to reach out and just try to make an appointment with a private practice. If you are trying to tap into your insurance at all, my recommendation is call your insurance company first, because there are so many different plans and nuances that it's really beneficial to contact your insurance company and find out what your specific benefit coverage is. So you ask, like, what are my out-of-network benefits? Because a lot of private practices don't take insurance because since they are so small, it's a massive administrative burden, excuse me. And so it's helpful to contact your insurance company, and they can tell you who in your local area actually receives your insurance. And then they'll give you a huge list. You can kind of go through them, research those different private practitioners, see who you think would be a good fit for you. You can even contact them, try to get a little bit more of a sense of their specific flavor. And you can also see if they have a waiting list, what their specific price is, and kind of go from there. And just one way to do that, I mean, Google is a beautiful thing, but Psychology Today is a pretty robust category of just all of these therapists and practitioners. And it's kind of an easier way to ease in, because this can just be very overwhelming in itself. And as everybody's touched upon, we all have either a Department of Human Services or a Department of Health, and we can really assist in referring residents to our own communities, because, you know, although a lot of these systems work very similar to each other, we all know what specifically are in our counties or our local areas, and, you know, what services they provide. So that's my recommendation, is if you have any questions whatsoever, to go to your Department of Human Services. So whether that's your mental health administrator, your alcohol and drug abuse director, or somebody at a different department, my recommendation is really to go through them, because they know their specific system, and just navigating these systems can be really confusing. And it's just a little bit easier where we can be those community points of contact. Things are changing a lot, especially now with COVID, of what services are available, what funding streams. So I think it would be really beneficial kind of just to go through us if you do have any questions, because if we don't know the answer, we will get you to the answer. So that was really just a very, very truncated overview. We could be here for hours just talking about resources. I mean, some of us make a career out of it. So that's really just a snapshot, but I'm going to drop a whole bunch of those resources that I did touch upon in the chat. So if anybody wants to do any further research or has any questions, they at least know kind of where to go within their own community as a starting point.
Thank you, Meg. That was terrific. I appreciate you doing that. And I do have a follow-up question, or just maybe if you can expand a little bit, how important it is for the human service directors and mental health administrators to have a network of community agencies and nonprofit organizations that deliver the services that need to be delivered. And I guess maybe explain a little bit why it shows why, or underscores why, a cookie cutter approach across the state isn't necessarily the right approach, because every county is different and has different resources available. So anyone want to expand on that? If not, that's okay too.
Well, I just think that we always need more tools for the toolbox. So we are always looking to meet the needs of our residents, whether if we cannot do it governmentally, we always look at our community-based organizations, whether they're faith-based, whether they're a nonprofit 501c3 or government. I mean, how can we do this together? Because we're trying to quilt a system of care so that no one falls through, falls through the cracks. So it's almost, if you're looking at someone, you're like the trampoline, and where the mesh, trying to make sure no one hits the ground. So I'm sure that we always look for the opportunity to increase services that we don't necessarily have, try with shared services and partner with another county or an organization to provide those services if it's not, we can't do it ourselves. So we always look at those at those opportunities.
Great, thank you, Lisa. I think I'm okay with questions. We are out of time. If anyone has any questions, you are welcome to send them to me, and I will send them to our panelists, and we will make sure to get you an answer. And I just want to, again, take a minute to thank everyone on the panel today for taking the time out of your busy schedules to be here. And more importantly, to thank you for the terrific work that you do. And if there's anything that the association can do on behalf to help with the great work that you do, please let us know. So thank
much
you,
for
and I hope
having
everyone
us.
has a great day.
Thanks, John.
Thanks,
Thanks,
John.
everyone.
Always a
Take care.
pleasure to partner with you.